Hello and welcome to part 3 of my medical basics video about the anatomy of ear and nose and throat. We finished the ear and nose and now it's time for the throat. Before we start, do not forget to like, comment and subscribe. So, anatomy of the throat. The regions included in the term throat are the oral cavity, pharynx, larynx, and the major salivary glands. Okay, so first the oral cavity. The oral cavity it's the mouth, but additionally comprises the interior 2/3 of the tongue, the lips, hard palate, teeth, and alveoli of the mandible and maxilla. Its major function is to provide the milieu for satisfactory mastication. The tongue is a mass of interlacing muscle contained in a bag of cornified squamous epithelium. A bag of cornified squamous epithelium. It contains numerous taste buds and is essential for efficient articulation, mastication, and deglutition. The tongue, there's a nice image here, which I'll not show actually because you should be driving, so never mind. It's an image of the tongue and its component, the filiform papillae, circumvallate papillae, posterior 1/3 of the tongue, which is the lingual tonsil. A brief about the teeth, which provide the mechanics of grinding of food. The teeth, if you're interested in that, composed of enamel, dentine, and cementium. The primary dentition of 20 teeth is completed by about 3 years. There are 32 teeth in the secondary permanent dentition, commencing at about 6 years and completed by about 18 years. Again, if you're interested. The teeth-bearing alveoli of the maxilla are intimately related to the maxillary sinus. Occasionally, the roots of the teeth may rest within the sinus cavity and lead to sinusitis secondary to dental disease. As food is masticated, it is mixed with saliva and formed into a bolus, which is swallowed after the soft palate has occluded the nasopharynx from the oropharynx. This is the oral phase of deglutition, and it is voluntary. It is the first stage. The oral phase of deglutition, first stage, and it is voluntary. Pharynx. The pharynx is divided for clinical purposes into 3 regions: nasopharynx, oropharynx, and hypopharynx. It stretches from the base of the skull above to the cricopharyngeal sphincter below. The oropharynx and hypopharynx, although primarily concerned with swallowing, are so closely related to the laryngeal inlet that pathology in these areas may cause symptoms and signs in adjacent regions. The pharyngeal phase of swallowing is initiated when the bolus of food hits the posterior pharyngeal wall. The soft palate occludes the nasopharynx, the larynx is elevated, and the epiglottis falls back. The last 2 maneuvers protect the laryngeal inlet. Once the food enters the esophagus, it is propelled onwards by involuntary peristaltic waves, which is the 3rd stage. That was about the pharynx. So remember, 3 parts: nasopharynx, oropharynx, and hypopharynx. Larynx. The larynx has a rigid skeleton consisting of several cartilaginous structures. The most prominent of these is the thyroid cartilage, which inferiorly articulates with the cricoid cartilage. So, thyroid cartilage most prominent and inferiorly articulates with the cricoid cartilage. The flap-like epiglottis is attached to the thyroid cartilage and occludes the laryngeal inlet on contraction of the epiglottic muscles. The cricothyroid membrane provides a suitable site through which the airway can be maintained in an emergency. The larynx is subdivided into three parts: glottis, supraglottis, and subglottis. The glottis is the space between the vocal cords. The posterior third of the vocal cord is the cartilaginous arytenoids, and the anterior two-thirds is membranous. So the anterior two-thirds of the vocal cords is membranous. The first one-third is cartilaginous. The supraglottis extends from the ventricular sinus to the hyoid. The subglottis stretches from 1 centimeter below the glottis to the lower border of the cricoid. Food and saliva are prevented from entering the lower respiratory tract by the sphincteric action of the true and false cords. Additionally, during swallowing, the larynx is elevated pari passu with the hyoid bone so as to rest under the tongue. Food then passes into the lateral recess, piriform sinuses, rather than in the midline. The epiglottis falls back as a part of this protective mechanism. Did you get it? Good. Voice production. A little physiology about voice production. The larynx provides the basic phonatory sound upon which a voice can be produced. Adduction of the vocal cords produces a constricted area where the air pressure is reduced as it passes through the lungs to the pharynx, which is Bernoulli's phenomenon. The vocal cord mucosa is consequently sucked together, producing a rise in the subglottic pressure, which forces the cords apart again. This cycle is repeated to produce vibration and hence sound. Volume changes are affected by alteration of the subglottic pressure. Pitch alterations occur by modifying vocal cord length and tension. The quality of the raw basic laryngeal phonatory sound is further altered by the resonating cavities of the pharynx, mouth, and nose. Speech is ultimately produced by the interaction of the articulators, teeth, tongue, lips, on this phonatory sound. Salivary glands. For clinical purposes, they are divided into three pairs: parotids, submandibular glands, sublingual glands. So three pairs of salivary glands: parotids, submandibular, and sublingual. The parotids produce a mainly serous saliva, and the submandibular glands secrete a seromucinous fluid. The parotid duct opens into the buccal sulcus opposite the second upper molar tooth. The submandibular duct opens into the floor of the mouth, just lateral to the frenulum of the tongue. The sublingual glands open by multiple small ducts into the submandibular ducts and floor of the mouth. In addition, there are numerous minor salivary glands located throughout the oral cavity and pharynx. The function of the salivary glands are related to the properties of the volume of the saliva. So, salivary glands: parotid, submandibular, sublingual. Parotid produce
mainly serous saliva. Submandibular glands secrete a seromucinous fluid. The parotid duct opens into the buccal sulcus opposite the second upper molar tooth. The submandibular duct opens into the floor of the mouth, just lateral to the frenulum of the tongue.
The sublingual glands open by multiple small ducts into the submandibular ducts and floor of the mouth. Lymphatic drainage. Lymph nodes in the head and neck provide a barrier to the spread of disease, either inflammatory or neoplastic. Enlargement either implies primary disease of the node or is secondary to pathology in the head and neck, but less commonly from sites below the clavicle. It is essential to palpate the neck in a systemic fashion so that no area is missed. So, lymph nodes in the head and neck provide a barrier to the spread of disease, either inflammatory or neoplastic. Enlargement either implies primary disease of the nodes or is secondary to pathology in the head and neck, but less commonly from sites below the clavicle. It is essential to palpate the neck in a systemic fashion so that no area is missed. Nerve supply of the throat. The pharynx is supplied by nerve branches from the pharyngeal plexus. The laryngeal muscles, except for the cricothyroid, are innervated by the recurrent laryngeal nerve. The cricothyroid is supplied by a branch of the superior laryngeal nerve, and sensation to the subglottis and glottis is from the recurrent laryngeal nerve, and the supraglottis from the superior laryngeal nerve. Okay, so pharynx supplied by nerve branches from the pharyngeal plexus. The laryngeal muscles, except for the cricothyroid, are innervated by the recurrent laryngeal nerve. The cricothyroid is supplied by a branch of the superior laryngeal nerve. Sensation to the subglottis and glottis is from the recurrent laryngeal nerve, and the supraglottis from the superior laryngeal nerve. In the oral cavity, ordinary sensation and the muscles of mastication are supplied by the trigeminal nerve. The tongue muscles are innervated by the hypoglossal nerve. Taste to the anterior two-thirds of the tongue is via the chorda tympani nerve, which runs in the lingual nerve, and via the glossopharyngeal nerve for the posterior one-third and the pharyngeal wall. Okay? So, in the oral cavity, ordinary sensation and the muscles of mastication are supplied by the trigeminal nerve. The tongue muscles are innervated by the hypoglossal nerve. Taste to the anterior two-thirds of the tongue is through the chorda tympani nerve, which runs in the lingual nerve, and through the glossopharyngeal nerve for the posterior one-third of the pharyngeal wall. And this will be all about the anatomy and physiology of the neck from my book, from my collection, Ear, Nose and Throat, illustrated color text. Sorry you cannot see the illustrated color text. Thank you very much for watching. This is the first example. Next we will see either we move to a completely different book or maybe read some anatomy of the eye. Please like, subscribe, and please write in the comments. Thank you very much for watching this video, and please come and see my next
video.